Happening right now. The world continues to watch and wait to hear how the Pope is doing as he battles pneumonia. The Vatican saying today the 88-year-old's condition is stationary.
ABC 6 News anchor Alyssa Azara went to Providence College to hear from a professor on what could be next for the Catholic Church.
Pope Francis showed slight improvement Wednesday. According to the Vatican, he's now doing small amounts of work after coming down with pneumonia in both lungs.
I do hope he gets better. If he doesn't recover, I'm not entirely sure what would happen. I guess they'd have to go through a new process, but I think that he's been a good pope. He's been trying to do the best he can.
The 88-year-old pontiff was admitted to the hospital Friday when his bronchitis worsened. His declining health has many Catholics worried and some wondering what's next. ABC 6 News speaking to James Keating, a professor at Providence College who knows a thing or two about this process.
Catholics pray that he gets better, but he's 88, so popes are mortal like everybody else, and we have to be prepared for what's going to happen.
Keating says there are three options. Pope Francis hopefully gets better and can continue to serve as pope, or if he dies, the process begins.
The Catholic Church has had long experience of what to do when a pope dies, and those procedures would kick into gear. We'd have a conclave, and we'd elect a new pope.
Or lastly, he could be considered incapacitated, which Keating says is complex.
He has said before that he didn't want to resign. He didn't want to have two popes resign in a row. So that would be a more complicated question. They do have procedures for an incapacitated pope, but determining what incapacitated means can be very difficult.
Since becoming pope in 2013, Keating says Francis focused on working with people and changed the church in significant ways, like making global warming and immigration a major focus of his.
Francis has been a controversial pope. These have been controversial times. And so the question will face the conclave is, do we want more Francis or do we want a different kind of direction? Because one of the things Francis has done is he has not followed the typical means by which someone becomes a cardinal. He has chosen people from all over the world, some people in relatively small dioceses, to bring in their own particular perspectives. So when Pope Francis dies, whenever that happens, we will face a conclave like we've never had before.
In Providence, Alyssa Azara, ABC 6 News.